Welcome to Infectious Diseases TV. We share useful information about infectious diseases. Today, we're going to talk about a historical figure you think you know, and we're going to reveal how her true legacy is, well, more relevant today than ever before. So, when you hear the name Florence Nightingale, what comes to mind? For most of us, it's a very specific, almost legendary image, right? Yeah, you see her walking through these dark, grim hospital wards, a real beacon of compassion in the middle of a war.
And look, that image isn't wrong, but it is seriously incomplete. In fact, it kind of overshadows her most powerful and honestly revolutionary contribution.
Because what really changed the world, what saved countless lives long after that war was over, it wasn't just her compassion. It was something else entirely. To really understand how she turned numbers into a weapon, we have to go to the Crimean War, to the very place where her legend was born, a field hospital in Scutari.
When Nightingale arrived there in 1854, she walked straight into an absolute nightmare. The British Army was fighting a war, sure, but its deadliest enemy wasn't on the battlefield. No, it was inside these hospital walls, where your chance of survival was shockingly low. Get this, 42.7%. That means almost half of the soldiers who walked into that hospital never walked out. And the reason why becomes terrifyingly clear when you see the conditions they were living in.
It was the perfect breeding ground for disease. I mean, the environment itself was toxic. Soiled linens, vermin everywhere. Basic stuff like soap was almost non-existent. Just try to imagine it, 2,000 sick and wounded men, with only 14 bathtubs for all of them.
So this is the really crucial point. Soldiers weren't mostly dying from their battle wounds. They were surviving the enemy, only to be killed by preventable diseases like cholera and typhus that were just ripping through the one place that was supposed to heal them.
Nightingale saw this immediately. She knew the filth was the killer. Now, they didn't have germ theory yet, that would come later. She believed in miasma, the idea that bad air from decay was causing disease. But you know what? Her instincts were dead on. She basically declared a war on filth. She used her own money to buy essentials, hundreds of clean towels, fresh bedding, huge amounts of soap. She got the nurses to scrub the hospital from top to bottom. She improved the men's diets with better food, and she brought in strict hygiene rules, like constant hand washing. It was a complete environmental overhaul.
And here's the dramatic twist. She did all of this. She cleaned the entire hospital. And yet, the death rate from disease, it kept going up. Can you imagine? It was a devastating setback. She was fixing all the problems she could see, but she was missing the invisible source. Turns out, the real killer was hiding underground. A government commission finally discovered that the hospital was built right on top of a contaminated cesspool, and it was leaking into the drinking water. They were literally poisoning the patients with every sip.
So let's go back to this number. This was the crisis when she arrived, a horrifying 42.7% chance of dying in the very place meant to save you.
And this is the impact of fixing the root cause. As soon as the sewers were flushed and they got a clean water supply, the death rate plummeted to just 2.2%. It was an absolutely miraculous turnaround, and it proved that sanitation was a life-or-death issue. But for Nightingale, the fight was really just getting started.
When she got back to England, she wasn't just a hero. She was a woman on a mission. She knew she had to convince the stubborn British government that what happened in Scutari was a systemic failure that needed a systemic fix. She knew that stories and personal accounts weren't going to be enough. To change policy, you need cold, hard evidence. She'd kept meticulous records during the war, and now she turned all that raw information into an incredibly powerful weapon.
And this right here, this is her masterstroke. It's the famous coxcomb diagram, and it is a work of pure genius. In a time of dense, boring charts, she created this. Each wedge represents a month of the war. Now look at the massive blue areas. Those are the deaths from preventable disease. The tiny red slivers, those are deaths from battle wounds. In one single glance, even the most stubborn politician could see the truth. The army was killing its own soldiers through simple neglect. It was just impossible to ignore. Armed with this incredible data, Nightingale didn't just reform the military, she laid the very foundation for modern public health and nursing. And her experience in Scutari boiled down to one guiding principle that echoes in every single hospital today. Just think about that for a second. The #1 job of a hospital is to not make things worse. It sounds so obvious to us, but back then it was a truly revolutionary idea, and it became the moral cornerstone of her entire life's work.
Her impact is, well, it's all around us. She established the first professional school for nurses, turning it into a respected profession. She used her fame to push for public health laws that brought clean water and sewers to entire cities, saving millions. She pioneered the whole idea of using evidence to make policy. And the basic principles of infection control she fought for, like hand washing and clean environments, they're still our first line of defense in hospitals today.
So, the next time you hear someone say, "the lady with the lamp," remember the woman with the data. Remember the pioneer who knew that compassion has to be backed up by evidence and that sometimes the simplest measures are our most powerful weapons.
This is Infectious Diseases TV.
Please like and subscribe.